Welcome to Continuing Mobile Education for Emergency Medical Services Providers. This is Block 11, Pacemakers, Episode 3, Pacemaker Malfunction. After viewing this episode, participants will review the common complications of pacemakers encountered by EMS. Participants will review common emergent malfunctions with pacemakers. Finally, participants will review the pre-hospital management of malfunctioning pacemakers.
The common pacemaker malfunctions include failure to output, this being a failure for there to actually be delivery of the pacemaker potential, failure to sense, which may be an inability for the pacemaker to actually sense the intrinsic potential of the heart, pacemaker-mediated tachycardia, which may be a malfunction of what the pacemaker is actually sensing, as well as runaway pacemaker. The common complications of pacemaker placement include bleeding, which may be represented by a hematoma at the area of incision. Pneumothorax is another complaint given any sort of procedure that involves the chest wall, and infection or dislodgement of the leads. Pacemakers typically fail after a prolonged period of use. This is typically because there is low battery that may cause an inability for the pacemaker to properly sense. Pacemaker failure may occur because of a dysfunction within either the lead or the pulse generator. The pulse generator may be, failure of the pulse generator may occur because the battery power is too low, or because there is abnormality in the sensing of the pacemaker. Lead failures may be represented when there's a failure of pacemaker output. This is represented when a pacemaker potential is not initiated when it actually should be. For pacemakers that are firing at too rapid of a rate, this may be due to pacemaker-mediated tachycardia or runaway pacemaker. In these cases, a magnet can be placed on the patient because this will reset the pacemaker into asynchronous mode at a set rate that was previously programmed by the manufacturer.
Common pacemaker complications include failure to output or failure to deliver an electrical impulse, failure to sense or failure to sense the actual heart electrical conduction. Other issues include pacemaker-mediated tachycardia and runaway pacemaker. Complications from placement of the actual device include hematoma at the site of incision, pneumothorax, infection, and displacement of leads. Failure of the device usually occurs after a prolonged period of use. Parts that can fail include the battery, pulse generator, or leads.
The most frequent things that I have seen from a pacemaker is just a loss of conduction, or a pacemaker that actually is at the end of its battery range and might be just not sensing the way it's supposed to be. Very rarely have I had a pacemaker that is malfunctioning by not giving the right amounts of voltages, or is just not pacing in a proper sequence. I had one case that I know clearly that the pacemaker was malfunctioning, and that was probably about 10 years ago at this point. And it was clearly just a pacemaker that the leads had been disconnected or pulled free or whatever, and the pacemaker was attempting to pace the heart. So what we ended up doing was just putting our own pacemaker on and then basically pacing the heart a little bit faster than what that pacemaker was trying to do. So it in effect shut it off. We every now and again had some beats that were from that pacemaker, but it was a much better situation after that than it was initially when we first made patient contact. Again, managing a malfunctioning device can be difficult. It depends on the type of device it is and what it was implanted for to begin with. if it's for a bradycardia, or if a patient has a bradycardia, or they have beats that are too slow, we can actually apply our pacemaker and pace just a little bit faster than what theirs is, so that in effect we take over the responsibility of the pacemaker with our equipment. Again, don't forget that you have med control and their ability to access some additional information with the experts that are at that facility. And so that's a good opportunity there to see if there's something different that you should be looking at.
The most common complications in the field include failure of the battery and loss of conduction. The field management includes EKG monitoring, possible transcutaneous pacing, and contacting medical control for future direction.
Patients with pacemakers may present with a complaint of pacemaker malfunction. If these patients report that the pacemaker is firing firing inappropriately, this may be due to either a failure of sensing or pacemaker-induced tachycardia. These patients should be placed on a monitor, and by analyzing the strip, it can be noted whether or not the pacemaker is properly firing. Patients that present with a complaint of their pacemaker not working may present with complaints of symptomatic bradycardia. These patients should be assessed for chest pain, decreased perfusion, or other signs that are indicative of symptomatic unstable bradycardia. In these patients, they can prophylactically be placed on pacing pads, given the concern that these pacemakers may not actually function. In addition, a rhythm strip should be printed out to look for the heart's underlying rhythm, as well as for any potential or any pacemaker spikes that may not be followed by a QRS complex.
Any caveats of the management of malfunctioning devices is stay calm. That helps your patient out quite a bit. Make sure that you get your EKG on and evaluate what is going on, and if need be, make sure that you contact medical control and ask for some advice. Obviously, we don't see these things that often, so it's not expected that we're going to be experts on it. And remember that you have that resource to be able to call and ask some questions of if there is something that you could potentially do to alleviate the issue for the patient. There's no, in my opinion, as far as any safety concerns, there's not anything that's dire right away. Responders are not going to be affected by an implanted pacemaker. The voltages are just way too low to cause any problems to us. And obviously, inherent to the patient, the dangers would be that they have a pacemaker implanted for a reason, and if it's not working properly, then that can be dangerous to them. But with our pacemaker that we carry with us, we should be able to manage anything that would be presented to us at that point. In Monroe County, if a patient has a pacemaker implanted and they're stable enough, it's probably a good idea to transport to the hospital where the cardiologist works that originally put the pacemaker in. But obviously, if the patient is unstable, then your closest facility would be your best option.
Patients with complaints of pacemaker malfunctions typically will have their pacemaker interrogated in the emergency department or in the hospital once they are admitted. For this reason, it is important to know the particular brand of the pacemaker, as it will allow us to contact the proper technologist to actually analyze these pacemakers. When a magnet is placed on a pacemaker, it resets the pacemaker into essentially asynchronous mode. The pacemaker will fire at a set heart rate that was previously determined by the manufacturer. By knowing the brand of pacemaker, the intrinsic rate can be looked up online, or it may be noted in the patient's medical record.
Troubleshooting pacemakers starts with staying calm. Obtain an EKG and analyze the rhythm for the functioning of the heart and pacemaker. Assess for symptomatic bradycardia. Place transcutaneous pads on the patient as a precaution. Try to identify the brand of the pacemaker from the patient. Hospitals can use a magnet to reset a pacemaker. However, it is noted that this is not approved in the pre-hospital setting. After viewing this episode, participants will review the common complications of pacemakers encountered by EMS. Participants will review common emergent malfunctions with pacemakers. Finally, participants will review the pre-hospital management of malfunctioning pacemakers.